everyone, welcome to SQ TV. I'm your host Rajni Bharara. Today on the show, I have with me a very special guest. Her name is Dr. Sneha Nagilla. She is a naturopathy physician and also an MD in acupuncture. Today on the show, we are going to speak with her about naturopathy and everything, all and more about naturopathy. But before, we would like to welcome her to SQ TV and also to the show. Hello, Dr. Sneha. Welcome to SQ TV and welcome to the show.
Thank you so much. Hello.
So, Dr. Sneha, if you can please give your, I already have introduced you as in that you are a naturopathy physician and also an MD in acupuncture. But with this, if you yourself can introduce yourself to the audiences and can, if you can talk a bit about yourself and how did you become a naturopathy physician and how did you become an MD in acupuncture?
Okay. Yeah. Hello, everyone. I'm Dr. Sneha Nagilla, and I'm a naturopath physician, and I did my MD in acupuncture. So this is a very common question. Many do ask me, why did I choose to become a naturopath? So it's a very small thing I can explain. Story I can say. When I was in my 12th science, I always wanted to become a doctor. So that time, there was something that I've seen a lot of patients getting cured with naturopathy. It was so shocking to me to know there is a branch of medicine where they're not using any medicines, though they could cure a lot of conditions. So it was so impressing to me. So I wanted to know more about it, and I learned a lot about it, and that changed whole my life and my family and everybody around. So that is how I got into naturopathic medicine. It's a 5.5 years medical school. It's just like any other medical school. And then acupuncture is something very interesting during my 5 years of course, and I choose to do MD in acupuncture.
Okay, great. Also, Dr. Sneha, now coming back to the topic of discussion, which is naturopathy. So, I would like to know from you because people have an idea about, also if they don't know in detail, but they have an idea about Ayurveda and also about homeopathy, allopathy. But then when it comes to naturopathy, not many people know the exact meaning of naturopathy and what exactly is naturopathy. So if you can please talk about what is naturopathy and also a bit of a history about it. And then, so then we'll go to another question, but yeah.
Sure. Yeah, it's a good one. Yes, it's very rare. Like even I can say till my 12th, I never heard about naturopathy. That's the first time I got to know about it. It's very, very like few people know. I can say only from past couple of years, people are getting aware about it. Even today, it's very, very less, just because all the modern medicine has, taken over, and people started to forget about naturopathy. I can say like basic things that our body can heal by the nature. So people started to forget about it. Okay, and naturopath wasn't there in India till 1988 or something like that. It was introduced as a medical degree only in 1980s. So why it was not introduced before that? It was there around the world, like Europeans and Australia, US. There were naturopaths from very long, but not in India. That is because I can say in India it was not even a niche. People were having a beautiful lifestyle.
Yeah.
Okay. It's no need to teach anybody about the lifestyle diseases, or you need to sleep early, you need to get up early, or basic things. It was not required, and they were very low of metabolic conditions. And the other part of it is lately that we have forgotten about the basic nature of ourselves. And all in Ayurveda, Ayurveda and naturopathy are not different, that together. Okay. So the base of Ayurveda is, you can say, as naturopathy. So we follow only the base of Ayurveda. There are 2 steps in Ayurveda, and the second step is of medicines and surgery. Okay. The first step in Ayurveda, this whatever is there is what in naturopaths we follow. So many do have this misconception saying that naturopathy is from the Western medicines. No, it is totally not. It is totally about living a traditional lifestyle, and we use all kind of natural healing methods which will enhance your body's healing abilities, whereby your body can heal by itself. So this is briefly about the Indian history of naturopath. Um, where the first college has started, which is SDM College, is in Dharmasla. So they have introduced naturopathy as a medical school. So one of the main person in that there went to US, and he saw naturopath as a medical system, and he was wondering whatever they are doing and practicing is what actually is our Indian culture or Indian methods of healing. So why it is not in India? And then they have introduced that in India as a medical system. So yeah, briefly, it's about Indian naturopathic history.
Okay. So you basically are saying, so naturopathy actually tells that you get everything from nature. So if you get everything from nature, so then and if the problems occurs in you, so the nature has the ability to treat it also.
Exactly. So it's like we are here on earth from where we have come, from this nature, right?
Yeah.
So is the best person to know about us is the nature.
The nature.
So when we go against the nature, you do get different kind of conditions. So in naturopathy, all we say is get connect with the nature. That is all enough. Your body can heal and you can have a healthy and happy life.
Okay. Beautiful. Dr. Sneha, while you were speaking about and talking about the history of naturopathy, so you actually mentioned about Ayurveda and how Ayurveda and naturopathy are quite connected. And basically, the base of Ayurveda is how the naturopathy has been derived. So with this, also I would like to know from you, which was supposed to be my next question. So I actually want to ask you if you can, please differentiate between naturopathy, Ayurveda. So you already have. But if I ask you to differentiate between, homeopathy, naturopathy, and allopathy, so what would you like to tell?
Okay. So yeah, one thing is all of them do help and are there to support health, right? Now, let's talk from the allopathy, which is the huge thing that everybody knows what is allopathy. Okay. So, and also one more thing I'm going to add over here is which is the best way of medicine. Okay, among all of it. Now, everything is good. I would never say that homeopathy is good or allopathy is good or naturopathy is good. Everything has its own way of healing abilities. But when you look at allopathy, I explained about each thing. When you look at allopathy, it's a life-saving medicine. So any kind of emergency conditions, you can never come to me or a Ayurveda or somebody else. You have to reach an allopathic doctor. That is the only way.
Basically, it's
Sorry?
automatic. It's very automatic thing.
Yes. Okay. But when you look at any other condition through allopathy, there is no way they're actually curing. For example, take a diabetes. Okay. Have you seen any patient going to allopathy medicine, taking antibiotic drugs? Are they healing anytime in life? No. Thyroid? No. They do say like lifelong you have to use these medicines. So that simply says they're never treating the condition, but they're supporting your body to balance something. But it's never curing. Makes sense, right? So allopathy is something which works on the symptoms to suppress the symptoms or also to manage the symptoms. Okay. That is how allopathy works. One is in the emergency conditions where it is a life saving. The other part is for most of the conditions, it is only supporting, but nowhere it is curing. You see, very hardly anybody goes to an allopathy doctor would stop taking medicine. No, they keep taking medicine. I'm not saying it's wrong. That is how it is. They will manage the sugar levels or something.
Yeah.
Right. So in Ayurveda, homeopathy, and naturopathy, all of these come under Ayush medicine. So Ayush medicine is traditional Indian medicines that have put under one background where it is called as Ayush medicines. So all of these branch of medicines, we work on curing the root cause of conditions, not just the symptoms. Okay. And again, in homeopathy, as you know, they use some kind of medicine to enhance your healing abilities. Okay. It's a very small not chemicals, actually medicine they use. And that will trigger in your body to enhance the balance. Okay. And Ayurveda, I can see Ayurveda has everything. Okay, but right now you don't find all the Ayurveda doctors practicing in the same way. It's like they go with only medicine sometimes, but actually Ayurveda has everything in it. It has surgery, it has medicines, it has everything, I can say. So
Okay.
Ayurveda is the oldest medicine in whole world. Okay, and when you come to naturopath, okay, in naturopathy we work basically on the root cause of disease. Okay, so it's all about starting how this condition has started. Only when you know how it started, only then you can understand to cure that. Okay, so taking example of diabetes, as long as you take medicines to balance your sugar levels, it's you never curing it.
Mm.
So we work on why your sugar levels are increasing. So
Okay.
where that you're doing wrong, that your sugar levels are always being haywired. So when you
Mhm.
look at that part, where how and where it is increasing, and you correct that, you no more need to use any kind of medicines.
Okay.
Makes sense, right? So
Yeah.
this is how naturopathy works for any kind of condition, looking at what is the root cause of condition and where it has started basically.
Okay. Okay. That's that's a great explanation of these three medicine values. But if I you actually mentioned about diabetes, sugar, and let's also talk about blood pressure a bit. So when a person gets diabetes or high blood pressure, so Dr. Sneha, what allopathy does is they keep them, they keep the patients in a regular and constant medicines till the day they die. So they will
Yeah, they
have,
support their
yeah, they
body through
support
the
the, yeah,
medicines.
they
Yeah.
support the people, in the via the allopathy medicine. So if I talk about naturopathy, so if let's suppose the diabetes or the high blood pressure or low blood pressure have been taken a bigger form or taken a major form, so does naturopathy can naturopathy help the patients, and can naturopathy help them to get to
Of the medicines.
of the medicine? Yeah.
Yeah. So yes, this is a common thing, and I would like to explain about clearly. So, if a person is coming to me just diagnosed diabetes, I would not even put them on a medicines.
Okay.
Okay, so just by correcting everything, they would get better. Okay, for example, last month I had a couple who are diabetic from past 20 years, who are using insulin almost 26 or 27 units.
Okay.
Within 20 or 25 days, I've reduced the units to 4.
Okay.
Okay, so it's not that you come immediately we stop the medicines. We have to monitor your blood sugar level, and
Mhm.
slowly as the sugar levels comes down, we slowly reduce the dosage bit by bit.
Okay.
Okay, yes, you should never stop any of your medicines just all of the sudden, because your body gets used to it so well. See,
Yeah.
let's understand this in this way, that remember, our body can heal by itself. It has a huge connection, knowledge, that it can just do it work till the
Mhm.
time you support it well. If you don't support it well, how much ever it tries, it gives up. Okay,
Mhm.
it's called homeostasis. It always brings the homeostasis in your body.
Mhm.
So when for example, take a thyroid. If your thyroid is getting high, immediately your body tries to do something about it to bring it down. Okay,
Yeah.
like THS, if it increases. But if you're taking medicine to keep it in control, why will your body work? Will it works? No. Because it thinks, okay, my thyroid levels are balanced now. Why should I do any work to produce it or decrease it or increase it? Because it's balanced. So it, with time, what happens is it forgets its work. It works with everything, any condition. Now, all of the sudden, if you put them off the medicine, your body gets into a shock.
Yeah.
So
Mhm.
immediately it cannot recall and do it. Right? Even for you, if you do it work constantly and you're good at it, and you stop working for very long, and immediately if I give you the task, will you be able to do? No,
No,
because you
absolutely.
forget. It needs for you for some time to recall and relearn it. The same way, your body also needs some time. So usually for any medicine, if we reduce, we see the tests like thyroid levels or sugar levels or BP, we constantly check. Once it is in control for regular duration, we reduce a bit. and check again and again reduce it, check again reduce it. In that way, when you do it, your body gets to understand, okay, right now my sugar levels are a little high, I should do something. It start to work, it start to act. So when it is in the beginning stage, without any medicine we can manage, but if they are taking already high dose, it's very heavy, we do give our treatments. Along with our treatments and other protocols, we slowly reduce it. And sometimes if it is more if it is a condition, it's a complicated condition, they have multiple conditions, then we definitely be in touch with even their medical doctors, and with our and we with the medical doctors together we reduce the dosage.
Okay. I mean, I think that's a great way, because also if we need to lose our weight, so let's suppose if we are planning to lose our weight, so what people do is, they cut their 2 meals in a day,
Yes,
which
yes, yes.
actually hampers their body. But rather than cutting your 2 meals, you should, reduce your diet, reduce your food.
Yes, yes,
So
yes, yes,
that's
yes.
how your body can get used to it.
Get used to it,
Yeah.
and then it will be able to do on constantly. That's what it happens even with the weight reduction. Suddenly they stop it, and suddenly they increase it, because they
Yeah.
suppress their cravings for very long, their hunger for very long, and then they give up and they eat, and they think that nothing is working. So when you do in a gradual constant way, your body is able to support well, and you're not disturbing your body's like regular physical activities or metabolism, then it will be very easy for you to you know go through it.
Okay, brilliant, great. So, Dr. Sneha, also, a very important question. So, I actually have written it down. So, I would like to, ask from you. So, when it comes to the choice of food, organic is the best choice. But then, why is allopathy the first choice of treatment, and why not traditional medicine?
It's a very simple thing. People are not aware about it. You just said right in the beginning that people are not aware. Like, how many out
But
there know
then,
about naturopath?
yeah, but still, I mean, people do know about Ayurveda, and people do know that,
Yeah.
being in India, if we talk about living in India, and being an Indian ourselves, so but still, allopathy is the first way of medicine that we go for, rather than Ayurveda. So why is that?
Okay. If you have a fever, okay, if you come to me, I will tell you your fever not cannot go down immediately in 2 hours. The same thing, if you go to an allopathy doctor, they give you a any kind of paracetamol or any kind of medicines for fever. You take it, reduces. So what do you feel which is working faster?
Allopathy.
Allopathy. But the concept, they don't understand that it's not about you take the pill and you're suppressing your fever. It's not about your fever has to reduce in a day. So just that people have lost the knowledge about it, the awareness about it, and also the understanding. Who is teaching right now in any school or anywhere around the world about how your body heals, about how herbs work, about how Ayurveda or naturopathy works? So, if one gets awareness and knowledge and understanding about your body, then you definitely will not go there. Okay,
Okay.
you will understand. First of all, you should have the knowledge when to choose what branch of medicine. So it's you, once you understand about it, you will in default you would understand, okay, right now I have this, I would go to Ayurveda or naturopathy. Okay, right now I am not doing at all, I need a immediate help, then only I should go to medical system. So once you have this knowledge, you automatically go. So just from past a few decades, people have lost complete knowledge about all kind of Indian medicine of system. I
Yeah.
can say only from past like 5 6 years or a decade, it is getting in place that people are getting aware about it. So yeah, it's
Okay.
about that. It's as simple as it. Yeah.
I mean, I think that is the most correct way to explain it, and the most correct way to say it, because, being an Indian living in India, we are not trusting our own medicine. Earlier, we want everything to be in seconds. We want to be successful in a day. We want everything to be
Exactly.
done. Yeah. So, same goes for health also. So, we want to be treated in a
Very quick, like
day.
anybody, like I can say, like even 10 20 years back, a baby mothers never used to take babies to doctors every other day. Now you see every month, couple of times, mothers take their babies into hospital. I don't know, sometimes it is too painful for me to see such a small month's baby taking so many of medicines. Like, how do people were handling, even taking our parents, how they were handling us? They know what to do when you get fever, they know what to do when you get cold. Now no mother know that knowledge, that traditionally we are carrying, we have lost. And out
Yeah.
of fear,
Mhm.
people have got a lot of fever, like little fever or little cold, immediately they get the fear, and immediately they start to run to doctor.
Yeah.
So
Yeah.
it's all about lacking that knowledge and awareness, and the fear all
Yeah.
together is making people,
Mhm. I mean,
yeah.
definitely. Also, I think, earlier it used to be that one doctor used to treat our body and one doctor used to see us, diseases or problems that is going inside our body. But now, if we have to go for a fever, we have to go for we have to go to a one particular doctor. If we are having knee pain, then we have to go to another doctor. If you have to go for
Yeah.
eye checkup, different things. So yeah, there's so many doctors, so many specialized doctors now. Okay, so now coming to next question. So does naturopathy cure all the diseases, and does naturopathy covers all the diseases?
I cannot say cures all the diseases, but definitely supports all the diseases. Any disease, from a simple fever to Parkinson's disease, or any kind of cancers or dementias or atrophies, anything. Like, there
Mhm.
is no condition you can say we cannot treat them. Okay, we have treatments for all the conditions, but I cannot say we can cure all the conditions. Definitely no, because there are some kind of autoimmune conditions where it's like we cannot, and there are some kind of neurological conditions where nerve is completely damaged. Okay, so
I think,
for
which is, I think that also happens with allopathy too, because allopathy
yes,
also
yes, yes.
covers all diseases. Yeah.
Yes, yes. So the same way, like where even allopathy supports most of the conditions,
Yeah.
even here we can give supportive conditions, supportive treatments. For example, taking cancer. Okay, I cannot say we can cure cancer, but those who are undergoing chemotherapies or any other conditions,
Yeah.
through naturopathy treatments, whatever the side effects they have with the chemo or whatever the symptoms they have, we can support them to have an easy life. Instead of having painful life, instead of having all the other symptoms where they won't be able to even live peace. With this, we can support them with that. And also, there are some conditions where we can prevent further deterioration of condition.
Mhm.
Okay, so if suppose they have an autoimmune condition where the cells are getting died and all, so we can stop the progression of disease condition.
Okay.
Okay, yeah. So in this
Okay.
way, in simple, we can cure many conditions, but we can support all the conditions.
Mhm. Okay, great, great. So, also when a patient, so
Hmm.
when a problem is occurred to someone and if they are going to a naturopathy doctor, so if a patient is going to a naturopathy doctor, what kind of treatment or what kind of courses can he expect?
Okay. Yeah, this is a thing that, like, I would like to explain more that what kind of treatments naturopathy has. Okay, the number of treatments we have is a lot. It's not like few. Okay, and we never use one treatment for one person. Anybody comes, we use a combination of multiple treatments. Okay, so when we treat any conditions, we are not just treating one. Suppose a person is coming with the knee pain, for example, we just don't treat the knee, we treat whole body. So you come with knee pain, you come with back pain, you come with diabetes, you come with some autoimmune condition or some skin allergy or anything. We never treat one part of the body or one side of the part. We treat your whole body together. Okay, so it does not mean if you have knee pain, the problem is only in the knee. Okay, that must be originated somewhere in the stomach. Maybe whatever you're eating is not able to absorb well. So you have calcium deficiency, so you have knee pain. Until unless you don't treat your gut, your knee pain cannot heal because your calcium cannot be replaced. So the treatment modalities we have is one part is yoga and diet. Okay, here diet is we use as a medicine. Okay, we don't prescribe any kind of medicines as such. The only medicine we give is your diet. So you treat your food as a medicine. You don't need to take any kind of medicines. Okay,
Okay.
all the medicines are present in your diet. The second thing is we have something called hydrotherapy treatments. So what is hydrotherapy treatments are? We use water to treat any condition. There are two aspects to it. One is water is working as the element water. Okay, in Pancha Tattvas, the water is one of the things. When the water imbalance happens in your body, we replace it with the water applications internally or externally. And we also have some particular bathtubs where a particular part of your body should be immersed in it, and we add some kind of salt, some kind of herbs, which will help that part to heal faster. Okay, and not only externally, even internally. And that is about the hydrotherapy treatments. And the second thing we use is manipulative therapies. So what are manipulative therapies is all kind of massages that we use. So it's not the massages that you see regularly outside. It's called therapeutic massage. So particular condition has a particular movement of massages to be used. So we have in our hospital, I work in Sri Ayurveda Hospital. In our hospital, Ayurveda Naturopathy department, I work in. So in my department, we have almost 21 different kind of massages. So when a person comes, I decide according to what conditions they have, a particular kind of massages I prescribe, and our therapists do follow that. And we use a particular herbal oil. For pain conditions, you have different oil. For weakness, you have different oil. For rejuvenation or detoxification, so we have different kind of herbal oils. So with that, they do massage to your body for the particular effects. Okay, that is about the manipulative therapies. And the other part is acupuncture. So acupuncture is one of the major modalities that we use for almost all the conditions, and which works to balance your energy system in the body. So whenever I briefly explain you, whenever you have imbalance in the energy flow, you end up have the conditions. So in acupuncture, we use needles or some other kind of equipment on your chakras, energy chakras. When we insert that needle into the chakra, immediately any blockage, any imbalance in the energy flow gets balanced. In default, your body start to heal better and faster. As you give acupuncture, you fall asleep, because it's like one acupuncture is equal to 7 hours of sleep. It relaxes your body so much. So it balances your hormones, your enzymes, your neurotransmitters, your everything in your body gets better. Okay. That's the modality we use. And we also have cupping therapy. We also have Gosha treatment. It's difficult to explain detail. I'll just mention the names. And we also have something called Marma Chikitsa and Meru Chikitsa and craniosacral therapy. I mean, it's not like every naturopathy center has all of this, but in our hospital, I have integrated all of these treatments together. Okay, and the other part is we use some kind of herbal packs. So we make herbal mixtures and apply on the particular parts, or sometimes the whole body.
Okay.
And we use enemas and Vamana Kriyas and full-on hydrotherapy. So we integrate all this together, and then we give the protocol according to what conditions, what age they are, what other medical, based on medical reports and all, and then we plan the treatments for them.
Okay, beautiful. So, I mean, listening to you now, we can come to know that how deep is naturopathy and how important it is for people, and how can it actually not just treat it, but it can actually cure your problems, from the root. So, but people have to be more aware about it. Yeah, like you mentioned.
Yes.
So before I let you go, doctor, so recently when COVID-19 happened, people did all kind of treatment, and some worked for them and some did not. So if I talk about naturopathy, so if a person is going through that kind of virus, so how can naturopathy help them in their treatment?
Okay. So in naturopathy, first of all, we don't take it into a very serious condition. Okay, it is a serious condition. I'm not saying COVID was an easy situation. It was a very tough situation. But by giving a proper support to your body, I can say you can heal a little faster than otherwise. So whatever you were seeing in COVID time, like the facial steam and the herbal drinks, like a
Yeah.
herbal teas. Okay, all of them started doing that from when? Only from COVID time. Were they not existing before? It was there. All my patients before COVID knew it, that when they get any kind of fever, any kind of viral, any kind of bacterial, they have to take steam, they have to take kashaya, and they get better. Okay, so it's there from very long time. So it will help them definitely to enhance their immune system, and also to support, eliminate whatever the damage is happening because of the COVID in the body. Okay. Yes. The other thing happened during COVID time is there are so many controversies came that kasha is good,
Yeah.
it's not good, and so there are WhatsApp videos and messages came into existence that it's wonderful. You need to drink this kada and this kasha and all. And later on, it came. It's good. It's bad. It damages your body. So let me give some clarity about it. It is amazing, but it's not that the kashaya suits for everybody in the same way. We have different kind of kashaya for different body types. If you have pitta body nature, the kashaya is different. If you have vata, your kashaya is different. If you have kapha, your kashaya is different. The second part of it, thinking it is good, people started drinking per day 3 times, 4 times. What happens? It definitely, your body cannot take so much of heat, right? One is you should know what kind of kada you should take. Second is there should be a limit. How much are you taking? Okay. So one thing during naturopathy works amazingly to support COVID situations. Okay, like if they have no much symptoms, you don't need to take any medicines. Just by managing well, you cannot do by yourself. You need to reach a doctor, because sometimes you may think you don't have symptoms, but maybe your symptoms are more.
Yeah.
You're not aware, so you have to get your test done. You have to reach a doctor, and then we will be able to say that you need immediately medical attention. Or you can, even medical doctors said during COVID time, do not take more medicines if you don't have much symptoms. But what happened was, even though you don't have symptoms much, they started taking a lot of medicines, so which actually lead to more complications. You know, so these are the few things you have to look. If it is, it will work amazingly. If it is not the severe condition, and you will have only complicated condition if you have multiple problems in the body, multiple organ problems or age, and also more than anything, phobias.
Absolutely.
So no symptoms, nothing. You just see somebody in the family got it, and you get severe fear, and then you get COVID. Okay, it's just I should say this, that more than anything else, the phobia and fear has made people's life more ruined than anything else.
Okay.
Okay, so it will help to calm down when we introduce naturopathy during COVID time. We can help the mentally to stay calm and the symptoms to resolve better. And you can also take naturopathy treatment along with the Ayurveda, along with the allopathy medicines. So that will also help you to heal faster. Okay, but yes, you cannot sit at home if you have little symptoms more, or if your oxygen saturation is less. You have to go to allopathy doctor, and you have to make sure that your parameters are getting back to normal.
Okay, great. Thank you so much, Dr. Sneha, for coming to SQ TV and speaking with us. And thank you so much for all the information that you gave about naturopathy, which I think is a high time for people to know about. And because, these are our medicines, our Indian medicines. People have this idea about naturopathy that it is from the West, but no, it is not. And it is actually derived from India and Ayurveda. So thank you so much for clearing out the confusion, and thank you so much for educating us on the topic.
You're welcome. And I really appreciate for you to taking, taking interest in it, to spread this knowledge and awareness to everybody. Thank you so much.
All right, guys, that's it from SQ TV. Keep on watching and do subscribe to the channel.